Hi, everybody. Welcome to Live Stories Podcast, People Helping People. I'm Shara Gosvick, your host. My guest today is Dr. Julie Siemers. Dr. Julie is a nurse, an educator, a TEDx speaker, and a patient safety expert. She is working very hard to teach patients what to know when to go into the hospital and how to communicate with the hospital staff, but also nurses and doctors and people who are working with patients. She talks about how important communication is. And she told some incredible stories today. I think this conversation will be valuable whether you work in a hospital or not, whether you are a nurse or medical staff or not, or if you are a patient that has questions and doesn't understand something about your hospital stay. I think this conversation is for you. I thank you for being here. Dr. Julie, I'm so excited to talk to you today. I think your message is so important for people all over. And so I'm really honored to get to learn all about you and about what you're doing. I think this is going to be very helpful to a lot of people. So
Mhm.
welcome to Life
Thank
Stories.
you. Appreciate it. Happy to be here.
Yeah. So you are a nurse, an educator, and a patient safety expert, and you've been doing this for decades, many
Yes.
decades. So what inspired you to become so passionate about patient safety?
And that passion just keeps growing. The more I research, the more I educate, the more I connect with people to, share this such important message, as you said. But it honestly started in 2009. I had been taking care of patients at the bedside for 30 years already by then. And my last job taking care of patients was on the helicopter. And so did that for 10 years, which was amazing, the best job ever. But I transitioned over to nursing education in 2009, and that's at the point I had my bachelor's degree. So at the university, I was able to teach in the simulation lab and take students to the hospital, show them how to do what we taught them. And I really had the passion to teach in the classroom too. So I started working on my master's degree, which required a thesis. And one of my instructors said, "Why don't you talk about unresearched failure to rescue?" And I said, "I don't even know what that is."
Yeah.
But when I started researching, I said, "How come we don't talk about this? How come I've been a nurse for 30 years and don't even know what this concept is?"
Yeah.
And so all that research, and then I continued on for my doctoral project, the same topic to go deeper. What I found just astounded me that so many patients are impacted. One study says 250,000 patients die of preventable medical harm every year.
Wow.
One study says up to 400,000. And if it's preventable, why is it still happening?
Yeah.
So that began my journey.
Yeah. So you said that you were astounded at things that you learned. What is something that surprised you? Like an example of something that surprised you as you begin to do research?
The amount of patient harm that occurred
Yeah.
because we just don't talk about it. And I don't ever recall even being in the hospital talking about how we can prevent cardiac arrests in the hospital. 80% of them are avoidable, preventable.
Wow.
And we don't talk about, well, what is it that we do to prevent those?
Yeah.
And so the nurses obviously play a really big role because they're at the bedside
Sure.
usually for 12 hours.
Yeah.
And I say to the students, we're the eyes and ears for the physician. They can't be at the bedside like we are. And it's our responsibility to say, hey, this patient's respiratory rate is rising. Something's going on.
Right.
But if we don't tell them because we don't recognize, oh, that's a problem,
Yeah.
then the deterioration continues.
Gosh, nurses are so important, and have so much respect for what they do and appreciate good nurses. I mean, man, what a gift. What a gift. So, what are some of the biggest hidden risks during a hospital stay that people don't think about?
70% of patient harm events can be traced back to communication breakdown.
Oh, wow.
This actually comes from the Joint Commission, which accredits hospitals, right? So that's pretty powerful. And it's not just this last year, it's been ongoing for a while.
Yeah.
So that's a huge opportunity is for us to close that communication gap. So that includes what I call the patient care team is not just doctors, nurses, pharmacists. It includes the patient themselves and the family members. And that communication then needs to be a two-way street. We as family members need to speak up and say, I know my mom's 70 years old, but she's not normally confused. Something's going on.
Yeah.
Because a lot of times in our hurry to do all the tasks as a nurse or healthcare team, we make assumptions.
Yeah.
Oh, well, she lives in a nursing home. She's 70 years old. She's got to be normally confused, and she's not.
Right.
So, learning to speak up for patients and families to really become a partner in care for our loved ones is huge.
Yeah.
And the other part of that is the healthcare team listening
Right.
and hearing what's being said.
If somebody was going into the hospital tomorrow, what is one thing you would tell them to do?
I would say first, research your hospital and see if it's the safest choice in your area. So there's a website, hospitalsafetygrade.org,
Oh,
where
wow.
you can put in your zip code in any state, and you can see the hospital rankings from A to F. F,
Mhm.
just like high school or college,
Yeah.
they fail. And believe me, there's a number of F-rated hospitals. Even D
Wow.
is pretty crummy. But there's 32 quality and safety indicators to create that score.
Yeah.
That's the first thing I would do. In fact, I was talking to an attorney about a month ago who's 7 months pregnant. She's helping me with my nonprofit. And she said, I didn't know that. So she just got on the website and she goes, oh, the hospital I was planning to have this baby is only a C.
Wow.
Versus there's a hospital just 30 minutes further
Yeah.
that's an A-rated hospital. I'm going to that one.
Oh my goodness.
Yeah.
Well, I'm gonna have that on the screen for people, and I'll post that website. I didn't know that either.
I would say the other number one thing is for patients and families getting ready to go in the hospital is learn to speak up. And this is what I talk about in my TEDx talk. Again, that building that bridge between the communication of healthcare providers and patients and their families is so essential. But a lot of people will say, well, I'm scared to ask the doctor questions, or I'm scared to say to the nurse, what medication are you giving my mom?
Right.
But it is so important because just that question could say, oh, well, I'm giving her blood pressure pill. Well, she already had that pill this morning.
Right. Right.
Oh, I didn't realize that. It can help prevent mistakes. And I know it's scary, but thinking about the flip side, if we don't speak up and ask questions and become an advocate,
Yeah.
then harm may occur.
Right.
So,
That was gonna be my very next question is why do you think people are intimidated to do that? I know people don't want to be labeled difficult if they're, asking too many questions or causing a problem, but you're right. I mean, that could save somebody's life, you know?
yeah, we have to change the culture.
Yeah.
And the culture is very hierarchy driven. We still in this country put a doctor on the pedestal. And I'm not, disparaging their 12 years of medical school
Right.
and residency and education, but they're human
Yeah.
and they don't know everything.
Right.
Just like nurses. I've been a nurse 46 years. I will never know everything. And I
Yeah.
forgot so much.
Right?
Yeah. And so if we just remember they're human,
Yeah.
and they've got families too, and we just have to change the culture by having the confidence to speak up and ask questions. And if they get grumpy or short with us, again, they're human. Do not let that discourage you, from asking questions and speaking up because, again, the consequences are ones that personally I would not want to live with if I just
Exactly.
stay silent. So,
Exactly. One of the things that you tell patients is to ask nurses questions at their shift change. What are some questions you tell them to ask or things that you tell them to say?
that's interesting you bring that up because the handoff, which is shift change
Mm.
between nurses or even when doctors, if there's
Right.
intensivists in the hospital, so much gets lost in priority of what's going on with that patient or what happened during the day. And it's nobody's fault. They're just trying to get through giving handoff for 6 patients or whatever they're caring for, or 2 or 3 critical ones. And not everything gets written in the chart.
Right.
And electronic medical records are a little nutty to navigate, meaning
Yeah.
the nurse may write something important or the doctor, but the oncoming shift doesn't see it. And
Mm.
so I always tell patients and their families to take a little journal, a little notebook, and just write things down. Not because we're looking for a lawsuit. That's not the point.
Right, right,
It's to just say, well, that's interesting because yesterday the doctor said this and that's conflicting.
right,
Or can we follow up on that lab test or that pathology test that was done yesterday? We're waiting for the results and nobody's told us yet. And so it's just to keep organized I call hospitals a foreign country.
right. It kinda feels
Different
like that
jargon.
sometimes, yeah.
Don't understand the language, and sometimes healthcare providers forget to use layman's terms. A doctor will walk in the room and say, "Hey, well, your dad's been diagnosed with congestive heart failure. We're gonna do an echocardiogram and put him on a diuretic." And they walk out of the room. And you're like,
Right.
"What did they just say?"
What about for people who have, parents that are aging and they're vulnerable? What should they prepare for before they go into the hospital?
A list of current medications is essential.
Okay.
And medications in the hospital, if they're giving them a blood pressure pill, is it the same one? Is it the
Right.
same dose? And then the other really essential part of hospitalization is discharge.
Yeah.
So the nurse giving directions for discharge, and you should get written instructions as well, should include who do I follow up with and when, and what we call a medication reconciliation.
Yeah.
So, my mom took these pills at home. Is she going back to the same ones or have they been adjusted?
Yeah.
And then, and I'll give you an example, a patient that had knee surgery was sent home on a medication called Lovenox, which is a blood thinner.
Mhm.
Well, she already took a blood thinner pill for a condition that she has called atrial fibrillation. And so that blood thinner was to prevent blood clots from this heart dysrhythmia. But the double dose after surgery and her previous blood thinner caused that wound to bleed excessively, and she had to come back to the hospital and get it drained.
Wow.
And so it's just asking those questions. Oh, if that's a blood thinner and she already is on one, does she need both? Which
Right.
should have prompted the nurse to call the doctor and say, "What do we wanna do here?"
Yeah. You said that you worked on the helicopter for 10 years. Tell me about that role, what you learned when you were doing that, or something, a story that really moved you during that time.
Yeah, it was amazing. The training was intense
Okay.
because we were able to do what's called expanded scope.
Mm.
So nurses typically can't intubate a patient, which is putting down the breathing tube into the lungs.
Right.
We can't put in central lines. We can't do chest tubes, those kinds of things. But we did get the training because sometimes those skills were necessary if we picked up a patient, far away from the hospital, like a traumatic, you know,
Right.
car rollover, whatever, or at a remote clinic where the patient, it would have saved their lives or made a difference. And so it was another learning experience that was pretty intense. The other part, I guess, and I was ready for it, but the autonomy of we had protocols that we went by and a medical director who, backed us and did chart reviews monthly with all of us, and we learned from those experiences too. But there's not a doctor in the helicopter, and you may not have radio
Mhm.
access to, "Hey, doctor, this is what's going on." And so the responsibility at times felt pretty like this patient's life is depending on me, number 1, placing the tube in the lungs and not the esophagus,
Right.
or, giving the right medication at the right dose if I don't have a protocol. So it was exhilarating. It
Wow.
really was. We got to make a really big difference in those patients' lives.
Yeah, I guess so. I always say I appreciate people who do those kinds of hard jobs that other people can't or don't wanna do. So thank you for doing what you did. You talked about how the culture needs to change and the patients need to know to ask questions and they need to know to be respectful. But what if they feel brushed off by a nurse or medical staff? What should they do in that moment?
That is an awesome question. So, there is something called the chain of command.
Mhm.
So, start with the bedside nurse who's taking care of your mom or dad or son or daughter. If you don't get action or you don't get an answer that feels right to you, you need to escalate. The next level of command is the charge nurse. After the charge nurse, if you don't get resolution and you're still really worried, you can then ask to speak with the house supervisor, who is a nurse over all hospital patients and nurses and situations.
Yeah.
And then after the house supervisor, there should be a patient advocate. There should be a risk committee that you can get a hold of someone. And then there is the administrator on call. So 24/7, the hospital administration has someone there to listen and to take your concerns seriously. Hope you don't have to go that far.
Right.
But I would also say to the nurses, you need to call the attending physician. You need to
Yeah.
call my dad's doctor because something's going on. And so, one thing I teach and talked about this on my TEDx talk is the cuss words.
Yeah.
So, I'm concerned, I'm uncomfortable, I'm scared, and this is a safety issue.
Yeah.
So you can say something like, I'm really concerned. Why does my son have abdominal pain? He had chest surgery. Something's not right here.
Right. Right.
And those questions should spark the attention of the healthcare provider to say, oh, yeah, you're right. Or why is my mom's heart rate 100? A
Yeah.
couple hours ago, it was only 80, and now she's breathing faster too. Something is going on.
Yeah. Yeah, that's so important. It's so important, and I hope that people listen to this and will not be afraid to speak up and ask those questions. If you could change one thing about the healthcare system today to reduce harm, what would it be?
Transparency.
Yeah,
We do not talk about what goes wrong. It gets
right.
swept under the rug. 80% of malpractice cases that hospitals settle with, they require an NDA,
Mm,
so a non-disclosure,
right.
which when we do that, how do we learn from other people's experiences?
Exactly.
And I think the secrecy, and I call it what's behind the Wizard of Oz curtain of healthcare.
Mhm.
What are we hiding and why? And we know why. I mean, we
Right.
live in a very litigious society. But the other thing is, there's been research on this. If doctors and hospitals would just admit that they made a mistake and
Yeah.
apologize, the frustration on the patient's end and the family when something goes wrong is that nobody will tell them anything, nobody will talk to them,
Right.
and they just feel completely dismissed. Um, and I can't imagine. I mean,
Right.
there's an example of a little 9-year-old girl that had leukemia, new diagnosis,
Mm.
went to the hospital to get her chemotherapy, and 10 days later, she was dead.
Oh
But it
gosh.
wasn't because of the leukemia. It was because she acquired a healthcare acquired infection
Mm.
called Clostridium difficile. And it took the family 4 years to figure out what had happened.
Wow.
So can you imagine the agony that they went
Oh,
through? Yeah.
yeah. That's awful. Tell me about your book, and I wanna know more about your nonprofit also.
Sure. My book is called Surviving Your Hospital Stay,
Mhm,
A Nurse Educator's Guide to Staying Safe and Living to Tell About It.
mhm.
And it's 19 chapters of information to help you understand and navigate the healthcare system.
Yeah,
So I address things like surgery and how to pick your hospital, like we talked about, how to choose a physician because you do have choices.
yeah,
And there's 30 stories in there. They're all true, unfortunately. I feel I learn by stories, and so
yeah,
I think other people do as well.
sure.
And what I'm doing right now is it's almost ready. I have an app coming for patients and
Oh,
family,
wow.
and it takes all of those lessons from the book, not the stories, but all of the lessons about why patient harm occurs.
Yeah.
And again, my mission is to inform and educate, just under help people be aware that we do have a problem and how you can be proactive.
Right.
So I try to provide solutions to this
Yeah.
problem. But yeah, I am actually revising the book at current because I kind of wrote it like a thesis and I put references in there, and I think it
Mhm.
makes it a little harder for people to but I'll just move those to the end of the book, so just kinda redoing that a little bit.
Yeah.
Yeah.
Awesome. And then tell me about your nonprofit.
Yeah, it is building access to communities for the app that don't have the funds or don't have the resources to pay for it. There's some free resources in the app, and then there's the free first course, which is what is patient safety and why is it a problem?
Right.
So yeah, building that just to, again, spread this information as far and wide as possible.
Yeah, that's awesome. Like I said in the beginning, I feel like this is such an important conversation because this affects so many people that listen. So, is there anything I have not asked you about that you want to tell me about?
Gosh, we've covered a lot. I think another one bit of advice I would give is diagnostic errors. There's about 800,000 of them every year in America.
Wow.
And so the failure to diagnose or the delay in diagnosis is really essential.
Yeah.
What you can do as a family member is make sure that you follow up and get those results of any diagnostic test that was done. Lab work, radiology reports,
Right.
pathology reports. One of the stories in my book, I'll just tell you real quick, was a man who went in, he had a brain tumor during surgery. They removed it, came out and told his wife, "Don't worry, it looked benign." Well, the pathology report that was completed about 2 weeks later, it was not benign, it was
Wow.
cancerous, but it got misfiled, and
Mm.
nobody followed up to get final results. They just figured they didn't have to. The doctor said, "Don't worry," they didn't. But 6 months later, his headaches are returning,
Oh
and
gosh.
when they do a CAT scan, they find a tumor the size of the surgeon's fist.
Wow.
Take him back to surgery, and then end up finding the first pathology report,
Yeah.
so they totally missed the diagnosis. He did, get that tumor removed and started chemo and radiation, but it was too late.
Wow. That's so scary.
Yeah.
That's scary.
So take the proactive approach,
Right.
is
Yeah.
what I say. And it's not because healthcare providers are bad people. They're not.
Right. Right.
But there's so many things, and we call it systems errors
Mhm.
that contribute to patient harm occurring.
Right.
So if we as patients and family members can speak up and learn that dialogue between healthcare providers and change the culture,
Yeah.
that's the beginning of changing the abysmal patient safety. And it's not just the US. The UK and Canada have similar patient safety statistics.
Yeah.
No, it's just being involved and
Mhm.
asking those questions and then just becoming a part of the solution yourself.
Right. Like you said, we're all human. Nobody is gonna get it right every time. Gosh, it's all so important. Thank you so much for talking to me. I really have been honored to talk to you.
No, welcome.
You
All
have
right.
a wonderful day.
I sure will. You too.
Thank you. Bye-bye.
Bye.